All right, guys, there's no time for long introductions. My name is Brandon Ayres. These are my financial disclosures, and this is a 90-second tip. Capsule retractors are essential in complex cataract surgery, and sometimes there's plenty of exposure to have the hook inside the eye, and the external portion doesn't get in the way. But so many times, things are tight and close and the eye's moving, and the external portion of the hook can bump on the lid speculum, it can bump on the lid itself. I've even had it get stuck on the undersurface of the drape. So here's the tip. These are flexible, disposable retractors. You can cut them. Cut the external portion of those hooks once they're in and in place, and that way you've got plenty of room to move the eye. You can cut one hook, two, or even all four of the hooks. That will allow you to move the eye like you usually would. It'll keep the support inside the eye, and it's not going to bump on any of the lid speculum, or get stuck on the drape. Now, a second part to this tip is make sure you use a sharp scissor. A dull Westcott is so frustrating. I've had it happen to me myself where I try to cut the hook and you just keep trying to cut and cut and cut. Instead of cutting, it just bends it, and then stuff is moving outside the eye and moving inside the eye. Try and make sure you use a sharp scissor. Usually, the back portion of the blade is still pretty sharp because it hasn't cut much. So typically, sharp scissor, use the back of it. So that's actually 2 tips in my 90-second tip. Hope you found this helpful.